Now, normally, when you hail a taxi, there are various hand signs you can use. But what if the new hand sign became something else, like a jab, Outlying communities in the Western Cape area are being visited by the Vaxi Taxi. It's a COVID-19 mobile vaccination service for those who may struggle to get to and from normal sites. EMS Vaxi Taxi Action Researcher Dr. Leanne Brady is going to talk to us now. Dr. Brady, good afternoon. Thank you very much for your time. What is the EMS Vaxi Taxi really all about?
So, as you said, it's a vaccination centre on wheels. What we do is we travel to parts of the city where it might be difficult to access the fixed vaccination sites, and then we offer people vaccinations. So it's quite a simple model. The way we work is we take a couple of ambulances and we park outside the front door of the community leader we've been working with. The ambulances become vaccination cubicles. We have a gazebo up in between so that we have a shaded waiting area, and then we have a dedicated cold chain unit that looks after the vaccine. So it's quite a simple model, really, but it means we get to partner with communities across the province in bringing vaccinations straight to your front door.
Yeah, I guess it's all about building trust as well, because there's so much hesitancy and so much misinformation and fake news around these vaccines.
Exactly, it absolutely is. And what we do is, before the event itself, we walk door to door. So we pair up some of my colleagues from EMS, myself and others pair up with sort of community leaders in that area, and we walk door to door to let people know that we will be, we'll be setting up a vaccination event in the next couple of days, and then we have conversations about the way people are feeling about getting vaccinated. It allows people sort of a one-on-one, face-to-face conversation with a healthcare worker, and what we've seen is that in this sea of misinformation, it's quite hard for people to know what to believe, and a few minutes of having their concerns addressed really does seem to make all the difference. That, and of course, for many people, actually accessing a vaccine site is still not that straightforward. And I think the collaboration with different community groups helps to build relationships, it helps to build trust. And for EMS, that's really important. I think what we have seen, sadly, over the last few years is an increase in the number of attacks on ambulance crews. And so the safety of EMS has become a real issue that we have been working on. And what we're seeing with the Vaxi Taxi is it's an opportunity to build a relationship outside of an emergency situation. So we've had so many great, meaningful events with over 40 different groups so far. And so that trust building is a key part of vaccination for us, both to sort of, change the nature of how the broader public sees EMS, but also for, dispelling the myths that surround vaccination itself.
Yeah, and so far, how is it going?
It's going really well. To be honest, we can't actually keep up with the number of requests that we're getting. So we're doing the best we can. So if you have reached out to us, we're working through all the requests, so we'll be in touch soon. We can't keep up with all the requests that we have received. And each event is different. Each neighborhood is different. So there's often, there's things we need to work out together. But what we've seen is people have been incredible. They've been so welcoming. So many people have opened up their homes to us, from Gugulethu to Tafelsig, from Philippi to Ocean View. We've had so many incredible events together, and it really does, it feels like it's changing the vaccination conversation, at least for us, but it's also changing the conversation that EMS often, changing the conversation for EMS, rather.
Yeah, I mean, EMS is for emergency. And it's very interesting that you are doing this. Of course, the pandemic is like a national state of emergency or disaster, as we know. Are you coming across a lot of hesitancy?
So, as I said, sometimes, but quite often after a few minutes of conversation, that really does shift. What we have seen is people worried about getting vaccinated if they have underlying illness. But once we have a good conversation about that, it's then clear to people that they're exactly who needs to get vaccinated. Or we have people are worried about whether or not they can get vaccinated if they're pregnant. And so And of course they can. And so we have these sort of very short conversations with people, and in most cases that, there's no hesitancy after that, and then we see people in the Vaxi Taxi a day or two later.
Yeah, I'm sure there must be a lot of lessons here. I mean, you said you're collaborating with different community partners, plus you're on the ground and you're talking to the individuals themselves. You are an EMS service, after all, that has to provide much needed, essential ambulance services when there is an emergency. But this public participation for EMS, what would its significance be, in your view, Dr. Brady?
Yeah, it's a good question, and I think we're still learning what exactly possibilities it does offer. But I think, it's not a given that an ambulance service would get involved in a vaccination program. I think, as one of my colleagues said, EMS is used to saving lives one at a time, and this is an opportunity for us to make a contribution to society more broadly. But it's also an opportunity for us to do community engagement differently, and for public participation to happen in much more collaborative ways than what we are used to. So we plan the event together. It really is sort of a joint effort, mostly at community kitchens, but other places too. And so I think what it offers is a way for many different community groups to start getting involved in the healthcare services that we deliver. And so right now we're focusing on the vaccination program, but the relationships we are building and the networks that it's allowing, I think, are going to offer all sorts of possibilities for other projects moving forward.
Okay, would you do it again, in the future?
I think definitely. I think many of my colleagues have spoken about this as well. The opportunity to see someone outside of an emergency, to have a chat, to get to know each other, it's sort of something that we're not used to, but it definitely helps to build a whole different kind of connection. And I think, of course, as we know, it's extremely important for everybody who wants to get vaccinated to have that opportunity. And so I think, EMS's constitutional mandate is to offer emergency care, but I think what we're seeing is that through the vaccination program, we can contribute, as I said, more broadly to society during the pandemic, but also it helps us build relationships, helps us build trust. So we would definitely do it again, and we really are grateful to be part of the program.
Now, thank you very much, Dr. Leanne Brady, Vaxi Taxi Action Researcher there with the local emergency services in Cape Town.